Hi, everyone. This is Nurse Anna from nursestudy.net, and I've had quite a few requests for burns questions. So here's a set of 25 NCLEX NGNs. Enjoy. And if you would like one of our free audio books with NCLEX questions on ACX or Audible, the links are in the description below. Enjoy the questions.
Question 1. A 45-year-old male patient is admitted to the emergency department with partial and full-thickness burns covering 40% of his total body surface area, TBSA, after a house fire. The nurse notes that the patient has soot around his mouth and singed nasal hairs. Which of the following interventions should the nurse prioritize? A. Initiate large-bore IV access and begin fluid resuscitation. B. Apply cool, moist dressings to the burned areas. C. Administer 100% humidified oxygen via a non-rebreather mask. D. Administer IV opioids for pain control. Correct answer, C. Rationale: the presence of soot around the mouth and singed nasal hairs suggests possible inhalation injury and airway compromise. Administering 100% humidified oxygen is the priority intervention to prevent respiratory failure. Fluid resuscitation, option A, is essential but is secondary to securing the airway. Cooling the burns, option B, and pain management, option D, are important but should not delay airway protection. Question 2. A patient with severe burns is receiving fluid resuscitation using the Parkland formula. The total fluid requirement for the first 24 hours is calculated as 14,000 milliliters. How much fluid should the nurse administer within the first 8 hours? A. 3,500 milliliters. B. 7,000 milliliters. C. 10,500 milliliters. D. 14,000 milliliters. Correct answer, B. Rationale: according to the Parkland formula, half of the total fluid volume should be administered in the first 8 hours post-burn, and the remaining half should be administered over the next 16 hours. Since the total calculated volume is 14,000 milliliters, the first 8-hour requirement is 7,000 milliliters, 50%. Question 3. A patient with 50% TBSA burns is 24 hours post-injury. Which of the following laboratory values requires the most immediate intervention? A. Potassium, 5.9 milliequivalent per liter. B. Hematocrit, 50%. C. Sodium, 130 milliequivalent per liter. D. Blood glucose, 180 milligrams per deciliter. Correct answer, A. Rationale: hyperkalemia, option A, is a serious concern in the initial phase of burn management due to massive cell destruction, leading to potassium release. Levels above 5.5 milliequivalent per liter can result in life-threatening cardiac dysrhythmias. While hematocrit, option B, and sodium, option C, changes are expected due to fluid shifts, and hyperglycemia, option D, is common due to stress responses, hyperkalemia poses the greatest immediate risk. Question 4. A patient with circumferential full-thickness burns to the lower extremities reports severe pain and numbness. The nurse notes the extremities are cool, pale, and have diminished pulses. What is the nurse's priority action? A. Elevate the extremities above heart level. B. Administer IV opioid analgesics. C. Prepare the patient for an escharotomy. D. Apply warm compresses to improve circulation. Correct answer, C. Rationale: circumferential burns can lead to compartment syndrome, causing vascular compromise. The classic signs, pain, pallor, paresthesia, pulselessness, indicate an emergent need for escharotomy to relieve pressure. Elevating the extremities, option A, may worsen perfusion, opioids, option B, treat pain but do not resolve the cause, and warm compresses, option D, are not effective. Question 5. A 30-year-old female with burns on 60% TBSA is receiving aggressive IV fluids. Which finding indicates the need to decrease the fluid infusion rate? A. Urine output of 25 milliliters per hour. B. Blood pressure of 88/50 millimeters of mercury. C. Crackles auscultated in the lungs. D. Heart rate of 110 beats per minute. Correct answer, C. Rationale: The presence of crackles suggests fluid overload, which can lead to pulmonary edema. Fluid resuscitation should be adjusted to prevent complications. A urine output of 25 milliliters per hour, option A, suggests the need for increased fluids, and hypotension, option B, and tachycardia, option D, indicate inadequate perfusion. Question 6. Which of the following findings in a patient with electrical burns requires the most immediate intervention? A. Myoglobinuria, dark brown urine. B. Sinus tachycardia on ECG. C. A potassium level of 4.9 milliequivalent per liter. D. A deep partial thickness burn on the foot. Correct answer, A. Rationale: myoglobinuria suggests rhabdomyolysis, which can lead to acute kidney injury due to muscle breakdown. Immediate fluid administration is required to flush myoglobin from the kidneys. Tachycardia, option B, and potassium at 4.9 milliequivalent per liter, option C, are expected findings in burn patients, and the foot burn, option D, is not immediately life-threatening. Question 7. A nurse is caring for a burn patient receiving silver sulfadiazine cream. Which finding requires immediate discontinuation of the medication? A. White, painless eschar formation over deep burns. B. Serum creatinine of 1.2 mg per deciliter. C. WBC count of 2,800. D. Mild itching at the application site. Correct answer, C. Rationale: leukopenia, WBC less than 4,000, is a serious adverse effect of silver sulfadiazine, increasing the risk of infection. White eschar, option A, is expected in deep burns. A creatinine level of 1.2 mg per deciliter, option B, is within normal range, and mild itching, option D, is common. Question 8. A patient with 30% TBSA burns is receiving total parenteral nutrition, TPN. Which assessment finding suggests a complication of TPN therapy? A. Blood glucose of 250 mg per deciliter. B. Mild abdominal distension. C. Slight redness at the IV site. D. Serum albumin of 3.5 grams per deciliter. Correct answer, A. Rationale: hyperglycemia, glucose greater than 200 mg per deciliter, is a common complication of TPN and requires insulin management. Mild distension, option B, and redness, option C, are common but not immediate concerns, and an albumin level of 3.5 grams per deciliter, option D, is normal. Question 9. A patient with burns is 6 days post-injury and develops a low-grade fever, tachycardia, and wound discoloration. What is the nurse's priority intervention? A. Increase IV fluid administration. B. Obtain a wound culture and prepare for debridement. C. Apply additional topical antimicrobial agents. D. Encourage high-protein enteral nutrition. Correct answer, B. Rationale: the patient is showing signs of burn wound infection or sepsis. Immediate wound culture and surgical debridement may be necessary. Increasing fluids, option A, does not address the infection. Additional antimicrobials, option C, may not be effective without culture results, and nutrition, option D, is important but not a priority. Question 10. A nurse is teaching a burn patient about autograft care. Which statement indicates the need for further education? A. I will keep my grafted area immobilized for a few days. B. I should report any foul-smelling drainage from the graft site. C. I can resume full range of motion exercises immediately after grafting. D. I should avoid prolonged sun exposure on the graft site. Correct answer, C. Rationale: early aggressive movement can disrupt graft adherence, leading to graft failure. Immobilization for a few days, option A, promotes healing. Foul-smelling drainage, option B, indicates infection, and sun protection, option D, is necessary for skin integrity. Question 11. A 50-year-old patient with deep partial thickness burns to the chest and upper arms reports intense pain despite receiving IV opioids. What is the best nursing action? A. Assess the patient's pain level again in 30 minutes. B. Request an increased opioid dose from the healthcare provider. C. Apply a hydrocolloid dressing to the burned area. D. Administer intravenous ketamine for pain relief. Correct answer, C. Rationale: hydrocolloid dressings provide a moist environment that helps with pain relief and wound healing. Assessing in 30 minutes, option A, delays relief. Increasing opioids, option B, does not address opioid-resistant burn pain. Ketamine, option D, is an anesthetic but must be ordered by the provider and is not a standard first-line nursing intervention. Question 12. A patient with 20% TBSA burns has a serum sodium level of 122 milliequivalent per liter on day 3 post-burn. What is the most likely cause of this abnormality? A. Excessive IV normal saline administration. B. Water intoxication due to increased oral fluid intake. C. Sodium loss through burn exudate. D. Administration of albumin and colloid solutions. Correct answer, B. Rationale: hyponatremia in burn patients often occurs due to fluid shifts and excessive free water intake. Patients may drink large amounts of water instead of electrolyte-containing fluids, diluting sodium levels. Sodium loss through burns, option C, occurs early but is not the primary cause on day 3. Albumin, option D, helps pull fluid back into circulation and does not cause hyponatremia. Question 13. A 9-year-old child with burns covering 35% TBSA is receiving fluid resuscitation. Which finding indicates adequate fluid replacement? A. Serum potassium of 6.0 milliequivalent per liter. B. Blood pressure of 78/50 millimeters of mercury. C. Urine output of 1.2 milliliters per kilogram per hour. D. Heart rate of 140 beats per minute. Correct answer, C. Rationale: adequate resuscitation is confirmed by a urine output of 1 to 2 milliliters per kilogram per hour in pediatric patients. Hyperkalemia, option A, suggests cell lysis and is a complication. Hypotension, option B, and tachycardia, option D, indicate ongoing hypovolemia. Question 14. A burn patient receiving IV fluid resuscitation becomes restless and confused. The nurse notes jugular vein distension, JVD, and crackles in the lungs. What is the priority action? A. Slow the IV fluid infusion rate. B. Administer IV furosemide. C. Elevate the head of the bed to 90 degrees. D. Call the rapid response team. Correct answer, A. Rationale: fluid overload can occur during aggressive resuscitation. The first action is to reduce the IV fluid rate to prevent further pulmonary edema. Furosemide, option B, may be needed but should be used cautiously to avoid hypotension. Raising the head of the bed, option C, provides symptom relief but does not address the cause. A rapid response, option D, is not immediately necessary unless respiratory distress worsens. Question 15. A patient with 50% TBSA burns develops a paralytic ileus on day 3 post-injury. What is the best nursing intervention? A. Insert a nasogastric (NG) tube and place the patient NPO. B. Encourage high-protein enteral nutrition. C. Administer IV metoclopramide to promote motility. D. Obtain a stool sample for Clostridium difficile testing. Correct answer, A. Rationale: paralytic ileus is common after major burns due to stress-induced hypoperfusion of the gut. NG decompression prevents vomiting and aspiration. Enteral feeding, option B, can be restarted once motility returns. Metoclopramide, option C, is contraindicated in bowel obstruction. Testing for C. diff, option D, is not necessary unless diarrhea is present. Question 16. Which lab result in a burn patient receiving IV albumin therapy requires immediate intervention? A. Hemoglobin, 15 grams per deciliter. B. Serum potassium, 3.2 milliequivalent per liter. C. Blood pressure, 90/55 millimeters of mercury. D. Urine output, 10 milliliters per hour. Correct answer, D. Rationale: oliguria, less than 30 milliliters per hour, indicates inadequate renal perfusion, suggesting continued hypovolemia despite albumin therapy. Hemoglobin elevation, option A, is expected due to hemoconcentration. Mild hypokalemia, option B, is common but not an emergency. A BP of 90 over 55 millimeters of mercury, option C, is low but not immediately life-threatening. Question 17. A burn patient with sepsis has a serum lactate of 5.5 millimoles per liter. Which intervention is most critical? A. Administer IV antibiotics immediately. B. Start vasopressors to maintain blood pressure. C. Increase IV fluid administration. D. Obtain repeat lactate levels in 4 hours. Correct answer, A. Rationale: elevated lactate, greater than 2 millimoles per liter, suggests poor tissue perfusion and is a marker of sepsis. Immediate antibiotic therapy is crucial to treat the underlying infection. Vasopressors, option B, are used only if fluids fail. Increasing fluids, option C, is important but should not delay antibiotics. Repeat lactate, option D, is necessary but is not the priority. Question 18. A patient with third-degree burns has no pain in the affected areas. How should the nurse interpret this finding? A. The patient has a high pain tolerance. B. Nerve endings have been destroyed, preventing sensation. C. The burn is beginning to heal, reducing pain perception. D. The patient is in shock, masking pain. Correct answer, B. Rationale: full-thickness burns destroy nerve endings, leading to no pain sensation. High pain tolerance, option A, does not explain absent sensation. Healing, option C, does not occur this early. Shock, option D, may cause altered mental status, but not complete pain loss in burned areas. Question 19. Which assessment finding in a burn patient suggests the development of Curling's ulcer? A. Increased gastric residual volume. B. Black, tarry stools. C. Severe abdominal distension. D. A positive Murphy's sign. Correct answer, B. Rationale: Curling's ulcer is a stress-induced gastric ulcer in burn patients. Melena, black, tarry stools, suggest GI bleeding. Gastric residuals, option A, may increase, but melena is the key indicator. Abdominal distension, option C, is nonspecific. Murphy's sign, option D, is related to gallbladder disease. Question 20. A patient with extensive burns is receiving continuous enteral feeding. Which assessment requires immediate intervention? A. Gastric pH of 2.5. B. Abdominal distension with absent bowel sounds. C. Blood glucose of 180 mg per deciliter. D. Mild diarrhea after feeding initiation. Correct answer, B. Rationale: absent bowel sounds indicate paralytic ileus or ischemic bowel, requiring immediate intervention. A gastric pH of 2.5, option A, is normal. Hyperglycemia, option C, is expected with stress responses. Mild diarrhea, option D, is common with enteral feeds but not an emergency. Question 21. A patient with 30% TBSA burns is receiving lactated Ringer's solution for fluid resuscitation. The nurse notes a serum pH of 7.30 and a serum bicarbonate level of 18 milliequivalent per liter. What is the most likely cause of this acid-base imbalance? A. Metabolic acidosis from hypovolemic shock. B. Metabolic alkalosis from excessive bicarbonate loss. C. Respiratory alkalosis due to compensatory hyperventilation. D. Respiratory acidosis from inhalation injury. Correct answer, A. Rationale: burn patients often experience metabolic acidosis due to hypoperfusion and lactic acid accumulation from tissue ischemia. The low pH, 7.30, and bicarbonate, 18 milliequivalent per liter, confirm metabolic acidosis. Alkalosis, options B and C, would present with elevated pH and bicarbonate. Respiratory acidosis, option D, is associated with CO2 retention. Question 22. A burn patient develops decreased urine output, elevated serum creatinine, and dark-colored urine. Which complication does the nurse suspect? A. Acute kidney injury due to hypovolemia. B. Sepsis-induced multi-organ dysfunction syndrome, MODS. C. Rhabdomyolysis due to muscle injury. D. Disseminated intravascular coagulation, DIC. Correct answer, C. Rationale: dark urine in a burn patient suggests myoglobinuria, a hallmark of rhabdomyolysis, which can cause acute kidney injury, AKI. Hypovolemia, option A, also causes AKI but does not cause myoglobinuria. Sepsis, option B, and DIC, option D, may occur later but do not directly cause myoglobinuria. Question 23. A nurse is assessing a burn patient's fluid resuscitation status. Which finding suggests that fluid resuscitation is inadequate? A. Blood pressure of 90/60 mm of mercury. B. Serum sodium of 140 milliequivalent per liter. C. Urine output of 50 milliliters per hour. D. Central venous pressure, CVP, of 8 mm of mercury. Correct answer, A. Rationale: hypotension, BP less than 90/60 mm of mercury, suggests inadequate circulating volume, indicating poor resuscitation. Normal sodium, option B, and urine output, option C, suggest adequate perfusion. A CVP of 8 mm of mercury, option D, is within normal range, 2 to 8 mm of mercury, and does not indicate fluid depletion. Question 24. A burn patient who is post-op from a skin graft reports intense itching around the graft site. What is the best nursing intervention? A. Administer IV diphenhydramine. B. Encourage gentle scratching of the area. C. Apply moisturizer and compression garments. D. Discontinue all topical medications. Correct answer, C. Rationale: moisturizer and compression garments help reduce itching and improve circulation. IV diphenhydramine, option A, can be used but is not the first-line intervention. Scratching, option B, risks graft damage. Discontinuing topical medications, option D, is inappropriate unless an allergy is suspected. Question 25. A patient with 20% TBSA burns is prescribed prophylactic enoxaparin. What is the primary rationale for this intervention? A. To prevent infection-related clot formation. B. To reduce the risk of deep vein thrombosis, DVT. C. To improve peripheral circulation in burned areas. D. To prevent disseminated intravascular coagulation, DIC. Correct answer, B. Rationale: burn patients are at high risk for DVT due to immobility and hypercoagulability. Enoxaparin prevents venous thromboembolism. It does not prevent infection-related clotting, option A, improve circulation to burned areas, option C, or prevent DIC, option D, which is a separate condition.